my job at the medical school would not have been possible without Dr. Mitchel Wong. I really love, he's going to talk more about his story with us tonight, but I really love his story. It's something that I've really been fascinated by, ever learning about Dr. Wong. It's a really great immigrant story, a story about the American dream, in my opinion. He grew up here in the Austin area, working with his family in grocery stores, ended up attending UT Austin, where he met his beautiful wife, majored in zoology and biology. And then I believe you applied for a job as a game warden initially, did not get that job, so decided to go to medical school, I guess, as your backup at Baylor College of Medicine, and then returned to Austin, where he's really served as a pillar of the community, especially in the ophthalmology community, for the last several generations. And a few years ago, he and Shannon decided to give back to the community in a huge way by making a really meaningful gift that with a huge goal of starting a residency program as well here in Central Texas. And we're achieving all of those goals. We have our first inaugural class of residents here today, the 3 residents sitting in the middle row there. And we're excited to start training them and educating the future ophthalmologists of our community. So I won't take too much more time, and I'll invite Dr. Wong up here. And after Dr. Mitchel Wong speaks, I think Dr. Shannon will also say a few words. So.
Thank you so much, and I want to welcome everybody to this, one of our first in-person meetings. You know, we haven't seen everybody for a long time. Anyway, I will share with you, Eileen summarized our story, but I will mention to you how unlikely it was that we would ever do what we did. My family on my dad's side came to Mexico, where he was working. He wanted to come to the United States, but after the Transcontinental Railroad was built, there was the Chinese Exclusion Act passed by Congress, which prohibited further Chinese to come to this country. So my grandfather was living in Mexico, and Pancho Villa was a revolutionary in Mexico, and he went across the border and attacked the city. So General Pershing was sent to Mexico to chase Pancho Villa. My grandfather was a baker, so he helped Pershing's army, supported Pershing's army while he was chasing Pancho Villa in Mexico. And then the Chinese Exclusion Act came, so he could not come to the United States. But Pershing got a special presidential waiver for 427 Chinese to come from Mexico to the United States and help construct the military bases in San Antonio. And so my grandfather came, and he had his wife with him. So they had 7 children there. So our family is one of the original Chinese families that settled in Texas. Now my dad and mother met, and my grandfather was in the grocery business. So that's the only business they knew. About 4 of the sons opened grocery stores in San Antonio. My dad wanted to open a store in Corpus Christi. So he went down to Corpus Christi and was getting the store ready. And he got a visit from some of the pillars of the community, I'll say. And they told him that he was not welcome in Corpus Christi. So he and his mother, he and his wife, my mother, decided to move to Austin. Austin's motto was the friendly city. So they moved here in 1937. Okay? And I know everybody in this room remembers what 1937 was. So he started a grocery store here. So when I grew up, all I knew was the grocery business. And one of our first stores was 714 Red River. That's a red international pickup, and we delivered in those days. That's my dad. And here is our store. And you can see the Superdome there. So we're just right down the road. 714 Red River. I started working in the grocery store from early childhood. So my background was grocery business. The lessons in life were from the grocery store. When I was about 6, I was working in the grocery store. And I sweep the floors or take care of the soda water bottles. And then I go ask my dad what to do next. So I was 6 years old, and I asked my dad. He kind of got mad at me. And he said, don't ask me to tell you what to do. Look around, see what there is that needs doing, and go do it yourself. That kind of hurt my feelings, but I remembered that lesson. And so I never really asked him to tell me what to do after that. And that was one of the best lessons that I ever got. So the way my thought processes are, I'm always evaluating the situation and finding what there is to do and go ahead and do it. I'm not scared to do anything. Let's see here. So this is our store, and I never aspired to do anything but work in a grocery store. You always want to do what your dad does. So I grew up in Austin during the war, Second World War. So anyway, this is a picture of me, or maybe 4 or 5, two of my friends. I was the first Chinese born here in Austin. There were nobody looked like me, but I didn't care. So this was during World War II. That's my sister. One of the big treats that we had in that time was to take a car ride. We take a car ride once a week. And one of the favorite places that I would go would be to the University of Texas. And I remember this because that statue's still there, and water comes out of the mouth of those horses. So this was a big treat. This is what we did on Sundays. We took a ride. My sister, I have 2 sisters. That's my dad, my mother. And it's a wonderful childhood. Since I was the only son, I was actually kind of spoiled. I was terrible. My parents did not believe in spare the rod, spoil the child. I got beat with everything known to man because I love to tease my sisters. I love to hear them holler. And then I get spanked. I was worried. I was sadistic. So, but all of a sudden, it just didn't appeal to me anymore to make them holler. Anyway. So, we had little family grocery stores. And this is a sample of the grocery store. Drive-in grocery store. You can see here, eggs, 39 cents a dozen, watermelons, 19 cents a piece, folders, 12 cents a pound. That's the inside of the grocery store. In those days, there's no air conditioning. You had to open the windows, so it was hot, it was dusty. This is at Red River, at 6th Street, and that store is still there. The name of our grocery store is Take Home Foods. That's supposed to be T-A-K-E, just left off E. Take Home Foods. So that was my life. I worked all through high school. I worked for neighborhood grocery stores. I was really, I thought my future was to be in the grocery business. So I graduated from high school, and I was working about 70 hours a week. And my dad came in and he said, you can work in the grocery store or you can try school. I never had a fondness for school. So I thought for about 5 seconds. I said, let me try school because I knew that I could always be in the grocery business. So I didn't know how to apply to college or anything like that. The only college that I knew was the University of Texas because we weren't Catholic. I knew there was St. Edward's, but this was the University of Texas. So I forget exactly how I applied for the university. But anyway, I made it in. And that was one of the major decisions of my life, deciding to go to school. Our family, they didn't ever prepare you to go to school. They didn't emphasize education. They just emphasized working in the grocery business. So I came to school, and on the first day of school, we were at the student union. And that's where the freshmen were getting to know other freshmen. I met this fellow named Bill. And we were looking at the new class. And Bill came up and he said, let's go to the BSU. BSU. That's the Baptist Student Union. I said, Bill, the Texas Union was where the action was. It wasn't at the BSU. So I said, Bill, I don't want to go to the BSU. He said, oh, well, they're serving supper. I said, let's go to the BSU. So, anyway, went to the BSU, and that was the only time that I ever went to the BSU. Went to the BSU and met a person at the BSU. The director of the UT-BSU was friends with the director of the BSU, Mary Hardin Bailey. And he or she had invited some students from MHB to be at the Texas BSU. Mary Hardin Bailey was an all-girls school at that time. So I met a young lady there, and it was, we had a nice conversation. 15 minutes, maybe 20 minutes, not that long. And that was her. And it was a very memorable conversation because I put that in my memory bank. She fulfilled all the qualities I was looking for. You know, morally very good, ethically great, quite intelligent, principled. She had left her home in China and come to this country when she was 16 years old by herself with a one-way ticket. That really impressed me because she had all of the input of her parents and family and left at 16. So that kind of reminded me of the advice that my dad gave me, you know. Don't ask me what to do. Look around, see what is needed, and get it done. So Rose and I did not have any contact with him for 2 or 3 years thereafter. I was going to school, finishing up, and she was finishing her school. So I attended university from 57 to 60, and then went to medical school. And I went to Baylor in Houston. There's a picture of Baylor. Now, Rose and I were married in 61, and we were blessed with a lot of children in a short period of time. In those days, you didn't borrow money. You didn't have money. You went out and worked and got a job and made a little money. So I was going to school and working. Whatever job came available, that's what I did. And so we finished medical school debt-free. Rose raised our 4 boys. We had 4 boys in 5 years. And a lot of them here, and I want to introduce to them. It's Shannon Wong. Let's stand up, Shannon. He's our youngest child. And then we have Patrick, which is the third child. He's got his master's in architecture from the University of Texas. And Sean Wong has Eyes of Texas. He's an ophthalmologist here in town. And then Shannon, our youngest, has Austin Eye here. So I'm very proud of our boys because we never had to have a talk with them about morals, about taking drugs or alcohol. We just didn't have those problems. So that's related to Rose's very ethical behavior and morals. Because I was working most of the time. She was raising the children.
You forgot Michael.
Michael. Michael is my oldest. I'm sorry, Michael. Where are you? Michael's back here. In fact, Rose always covers my tail. Thank you, Rose. Like I said, we've been married 61 years, so I'm not ashamed to say that. Did I forget anything else?
The fact that she was beautiful in her attribute list, you left out beautiful. I'll put that in. She's not good.
Well, there's a time in your life, Dr. Evans, when hormones rule.
I'll bet it's not now, though.
So anyway, we have, I went to medical school. Now that's the public story. Now I'm going to take you and tell you the other story. And the other story is what led us to establish the Department of Ophthalmology. When I was working in a grocery store, I was 15 years old, and I would close up the grocery store, close the door. I didn't have a key to the store. And I was approached by two fellows who had been drinking. And the significance is they had a gun. And they wanted the money, the receipts for that day. I told them I didn't have a key to the store. So we got in a car and drove around East Austin. I was in the back seat looking at the business end of the gun. And I didn't know whether or not it was going to be my last look. But these guys had been drinking. So on Riverview Street, which was unpaved, we got out of the car and they started beating me with a pistol. Well, these were all headshots. And I fell on the ground and actually was stayed as still as I could while they continued to beat me. They inflicted significant intracranial damage. And I spent 6 weeks at Brackenridge Hospital. I was in a coma for a long period of time because I can remember kind of coming out of coma a little bit. Those are the days when you had intracranial swelling. You didn't have steroids. And so I know that I was tied to the bed because I kept pulling out my IVs. And I had a broken jaw as a result of being hit with a pistol too. So my jaw was wired together and I had to have a liquid diet. But I was not coherent. But I survived. In those days, you didn't have psychiatric help to help you cope with that, compensate. You just had to figure it out for yourself. And I wondered why I was allowed to live. It was a close call. I had a traumatic carotid cavernosinus fistula, a lot of cranial edema, but I was still able to function pretty well. What was my purpose in life? I did not know. All I know is the grocery business was there, so I recovered and went back to working in the grocery store. like that Dr. Bowden said, I want to be a game warden. I wanted to ride around the lake with a boat and a motor and have somebody buy the cans. So I went and applied for game warden, to be a game warden. I made the first interview. Made the second interview. They liked my major, zoology. I was doing okay in school. And the last thing I remember them telling me is, we really like your, we like your application. We like what you've been doing. Don't call us. We'll call you. And I carry a phone with me. I haven't gotten a call yet. So the fallback is, if I didn't make game warden, keep going to school. So that's how I wound up with Baylor Medical School. I had an uncle who was a physician, and I always wondered why I chose medicine. I think that it was because I was treated for so long with my intracranial hemorrhages. So when I see on TV all these random, wanton injuries that people are happening, that are happening to innocent people, I know what they're talking about. I know what they're talking about. Why I'm here, I can't answer you, but anyway, I survived and actually am doing great. If you have two carotids and you ligate one of them, give you some food for thought. I couldn't get into service. And I couldn't get a residency because I couldn't get into service. This was during the Vietnam War. I tried to volunteer for the Air Force, the Navy, the Coast Guard, the Indian Service. I couldn't get into service because I had to get that obligation out of the way to get a residency. Anyway, I met a physician in Baylor, Dr. Bunyan. Dr. Edmund knows him. And I did a fellowship with him for a year. That was a really good fellowship because it actually, as when I got my MD degree and did an internship, I was making $25 a month for Ben Taub in Houston. And this fellowship paid $7,500 a year. I still had to moonlight and everything along the way because we were wealthy with children. What is the chance of going into ophthalmology when you start like that? I didn't even know how to spell the word. I misspelled it on my application. Not good. But anyway, I was walking around Baylor Medical School on the third floor one afternoon, and this professor in ophthalmology asked me if I wanted to help him in the OR. Of course, I'm a medical student. I'd love to help you. So I get to scrub my hands and put a gown on and go to the OR. And I sit there, and he does the operation, and then we're all done. Well, I was angling toward general surgery. But that, I kind of like the precision, the exactness, and the outcome of eye surgery, being an ophthalmologist. And so that kind of changed my direction. Why it would change my direction, I do not know. But anyway, I went through the residency in ophthalmology at Baylor, just like Dr. England. You will find that practicing as an ophthalmologist is one of the most gratifying things that can happen to you. Because you get up every day and you say, who am I going to be able to help today? It's amazing. The results you can see. You don't have to wait a long time. You don't have to give people a lot of medicine to see the results. You see the results immediately. So it was very satisfying. I practiced over 50 years, and it was wonderful. So you will see what I'm talking about. It's not about the money, it's about what you can do for other people. Now, when we moved back to Austin and started my practice, I just hung out in my shit book. There was no medical school here. Austin was a nice, livable town. It wasn't like you see now. It's changing quite rapidly. It was a nice, livable town. And I waited, just enjoy every day. I'd get up every day and be enthusiastic. There was no medical school. And then Kirk Watson, I invited him here today. He is running for mayor. He and Michael Dell worked together and with the University of Texas. And that's how Dell Medical School came to Austin. Now, Dell Medical School, Austin was ready for a medical school. We have the clinical material. We're located in several parts of Texas. A lot of tech is here. So it was a natural fit. Things happen. Okay, there's a medical school. I'm practicing ophthalmology. What can we do to further eye care and eye health in Austin? Well, obviously, start a business. Because I realized that one of the most noble professions is being an educator. So what you learn, if you show others, what you can do is limitless, because if everybody is helping each other, this is how you transmit knowledge. So that's, I realized finally, after not knowing what my purpose in life was, or why I was so fortunate enough to survive, at least that's one thing that we did. And I'm going to let Shannon explain our thinking on that. Everything, I've been living a long time, and everything always happens to me in a very favorable light. Why is that? I do not know. I see all these paint commercials on TV. Rose and I, we don't have any paint. We're happy. We just enjoy every day. We're still able to do things to where we're helping everybody, helping individuals every day. So every day is a blessing. Be thankful for every day. The most important day you have is today. Let's see. I don't want to talk too long. Shannon, go ahead. Shannon's going to tell you our thinking, because Shannon and I think a lot alike.
There's a button.
Oh, button. On. Well, thank you for coming out tonight. It's an impressive turnout. Well, just to answer his question, why was he brought into this world? He's brought in this world to have me. So, no, we're very appreciative of everybody coming out. And I don't really know where to start. I'll just share a little anecdote, is that, my favorite movie of all time is It's a Wonderful Life. It's the story of one person who could make a difference and touch the life of others. And, so I'm fortunate enough to practice ophthalmology, thanks to my dad and my mom. And we worked very hard, and we're fortunate that we're in a good position, and that we're able to give back. We're able to give back of our financial resources, and I'm young enough where I can give back with my time and my knowledge. I don't know why I'm getting all choked up, but so I just think it's a good thing. I do believe the saying that to whom much is given, much is required. So that's what we want to do. We want we're very blessed to have brought Jane to Austin and to have our wonderful, talented faculty who are here. Eileen and Eric, Harry, Jean, and more faculty on the way. And we're training medical students, which is exciting. Many are here who are the future ophthalmologists of the next generation. And we've had our first group of residents who are in their PGY1 year, and that's really cool. I mean, we've had a great journey, and I do want to kind of help the next generation do well and share my knowledge of medicine and surgery. But I really do believe it's super important to learn the business of medicine because it's changing, and if you don't understand the landscape, you might be you might have some regrets. And my goal is to educate you so you are well aware of the reality of how healthcare is run, and you make decisions in an informed way. So, thank you for the opportunity.
Really moving, really wonderful. Thank you for presenting. Mitchell, I always love the story you tell about your journey into Austin and to medicine and the immigrant story. And Shannon's your favorite son. I'm sorry, everyone else here who's here. And Michael, I think you look like Mitchell's dad driving that truck. Yeah, exactly. So ask phone call for you three. I have just a few comments. Thank you. Welcome, Prevent Blindness Texas, and thanks to Austin Ophthalmological Society for partnering in this event. I just have a few slides, and it really resonates our mission of the medical school, and specifically our department, the Mitchel and Shannon Wong Eye Institute. We have a mission that Mitchell commented upon, and that is helping people, regardless of payer type, all people, helping all people in eye health, and giving back and enjoying our lives. So I'm going to kick off and discuss what we're doing here to the Mitchel and Shannon Wong Eye Institute. So part of my, a great part of my enthusiasm for this position when I was looking at the job was the mission of Dell Medical School, which is pretty unique if you think about the mission of our medical schools we came from. Revolutionize how people get and stay healthy, and by improving health in our community as a model for the nation, and Mitchell's comment, helping people, improving health. Evolving new models of person-centered multidisciplinary care that reward value, and value is outcomes that are biologic outcomes and outcomes that matter to patients over cost. So that is what value is, but we've added in the patient-centric aspect of value here. Accelerating innovation and research to improve health, and educating leaders who have transformed healthcare, and that was one of Mitchel and Shannon's goals for their transformational gift. It established the Department of Ophthalmology. The dean was not entirely enthusiastic, I imagine, about ophthalmology, given his population health background. But Mitchel and Shannon and Betty and Rose, their gift, established ophthalmology. So we too were committed to educating the next set of ophthalmology leaders, and we so fortunately have the three of them sitting right here. So our first class, Brandon Bates from the University of Iowa. We have Kirby Taylor from, I'm sorry to say, Texas A&M. Okay, we forgive you, Kirby. And Arvin Mosina from UCSF. So we're so very proud of our great class. And the last is redesigning the academic health environment to better serve society. So those really forward-thinking, societal, our commitment and obligation to serve society, not just a small subset of people. That's what really resonated with me and the reason I came here. So I wanted to highlight what we're doing in the area of giving back. So the social determinants of health is a very popular, frequently discussed idea. It goes by that acronym. The social determinants of health are what guide our health. They're the main key drivers of general health. And you can see this this pie, and each of these aspects of health influence health. And only 20% of our health is influenced by access to quality health care, access to good doctors. Only 20%. The rest is where you live. Do you live in a food desert? Is it dangerous? Do you have someone to help you at home? Do you have a community? Behavioral aspects such as poor nutrition, smoking, alcohol, etc. Educational ability to obtain education, educational level, which influences economic stability. So it was shocking to me to find out that only 20% of U.S. citizens, typical U.S. citizens, only 20% of our health is access to great doctors. So, as you would imagine, the social determinants of health are also linked to vision loss. And this has been specifically studied, like which of these determinants of health are more likely to be linked to vision loss and blindness. So, as you would imagine, lower educational level leads to lower income, less well-paying jobs lead to less likely to seek or obtain health care, higher rates of diabetic retinopathy, hypertension, other chronic diseases, higher rates of under and uninsured, difficulty paying medical bills, finding a doctor, skipping doses of medicine because of cost. And the social determinants of health lead to disparities in eye health, which is another way of saying that is eye health inequity. We should all be given the opportunity for the best health, general health, and eye health that we can have. But if you have these factors in the middle box, you're much less likely to have good eye health, general health, eye health, and permanent vision impairment. So I pulled up this slide from the CDC. This is vision loss, blindness actually, self-reported very poor vision even with your glasses or blindness in a 2017 U.S. Census. And you can see that Texas is not the right color. We have one of the higher states of total economic burden of vision loss in Texas. And that is an economic burden calculated by inpatient and outpatient costs for the vision impairment, drugs, glasses, diagnostics, reduced wages of the individual, and then loss of household productivity, the parent or child who has to stay home with the blind parent. It also includes federally funded services for the blind and vision rehab. So you can see Texas is not doing that well in terms of vision loss for the safety net or vulnerable population. So what are we doing at the Mitchel and Shannon Wong Eye Institute to improve equity in eye health? So I've been in this job for a little less than 5 years, and I have amazing affiliate faculty that are in the community, many of whom are here today: Bob Wong, Andrew Fenton, Victor Rayraj, Denise Nakra, Philip Story. I'm sure I'm missing some that I didn't see come in. And my own amazing faculty, Jean Kim in cornea, Eileen Bowden, glaucoma, Harry Ong, who is neuro-ophthalmology, and Eric Kroll in uveitis. So what are we doing to improve equity in eye health? So partnering as strategic partnerships, as Heather pointed out, with local and regional agencies. So I was able to obtain a contract to provide care for the underinsured, and 900 people were on that. This is through Sigma. 900 people were on the waiting list who had never received eye care as part of their covered benefit. So that was a big boon for expanding access to eye care. We're also working with community care clinics. That's the largest federally qualified health center in Travis County, 25 health centers, trying to help them, as Bob Wong started this, understanding and mapping the tortuous process for under and uninsured patients to obtain eye care, particularly for diabetic care and access to screening and care. The second is we're just beginning to create high-value care models. We are creating a diagnostic screening clinic here at UT Austin. Referrals from our own building, UT Austin building, for diabetic retinopathy for primary care patients, drug-induced ocular toxicity, etc. And coming out with the last slide. Also partnering with Harbor Health, which is Clay Johnston's new enterprise. And these are primary care clinics that are sprinkled around town. They have not opened. And he is asking me and my team to develop best in practice model for diabetic retinopathy screening, which will include A1C control, nutritionist, weight loss, diet modification to prevent diabetic retinopathy or turn it back, walk it back. And the last is, as mentioned before, educating the next generation of leaders in ophthalmology, our 3 residents here, and that we established a residency. And my goal is to instill a lifelong commitment in our residents to health equity, caring for all people, a commitment to society, regardless of payer type. So I want to thank everyone who's been in attendance. And as Eileen commented, we would not be here without the generosity and the vision of Mitchel and Rose and Shannon and Betty Wong and their transformational gift to UT Austin and Dell Medical School. And I want to thank Austin Ophthalmological Society and Heather Patrick and Prevent Blindness. And I think we're done. Is that right? Yes, let's drink and eat and have a tour.